And my next guest says that her health care premiums using the Affordable Care Act marketplace would be more than 5 times higher next year. She's going to go uninsured because of that. But Beth Dryer says that she's in desperate need of coverage. She says that she has been diagnosed with several chronic illnesses that she says put her at high risk for breast cancer. And last time she spoke with us, she said that she was worried about making ends meet.
We just want to care for our families and go to work and come home and make dinner and not have to, worry as much as we do about what's going to happen if we get sick or what happens if we can't afford food or the water bill keeps going up so much, that we are people just like them.
Beth Dryer joins me now for more. Beth, good to see you. I'm curious your reaction when you heard that this shutdown was ending without those ACA healthcare subsidies that would have helped bring down the cost of insurance premiums for so many, including yourself. What was your reaction?
I was incredibly disappointed, but also not surprised. The way that the government is structured at this time with this Trump administration, the Republicans are pretty much just able to push through anything that they want, and the Democrats have absolutely no power to stop them from making these sweeping changes that are affecting so many people.
Well, and you live in Virginia. Your Democratic Senator, Tim Kaine, joined Republicans to advance this bill. Our Rachel Scott asked him why. I want you to listen to this.
The threat of these insurance premiums going up for millions of Americans was not enough to get Republicans to agree to extend it. So do you have any sense that has changed among Republicans?
Here, there are two realities. That threat is, if it's a drumbeat, it's getting louder every day.
So, Beth, what's your reaction to that explanation?
That's just a meaningless string of words that doesn't really help anyone, and it doesn't really explain why he decided to join with Republicans to move forward. Yeah.
I know the last time we talked, you said that you weren't going to be able to afford this. I saw that your premiums were going from about $80 to $420. That's more than 5x if my math is correct there. So what are you going to do in the meantime to take care of your health?
Well, I'm going to put money in a savings account as much as I can afford every month, and that's where the money will come from if I need to have any type of health care, but I already know that won't be enough. So I'm probably going to have to get a credit card just to be able to afford to go to the doctor, and then have to pay off that as I can. It's a less than ideal situation, and it's really scary to have to think about where life is going after this.
Yeah, well, and we understand that, look, premiums might be set for 26, but, there has been talk on the Hill about renegotiating these ACA subsidies. Are you optimistic that, in the future, there might be some deal that helps lower premiums for people like yourself?
I am not optimistic about that at all. I think that if that does happen, it's probably several years away. Once something goes away, it's very unlikely that it comes back in the same way. So I really can't see how we get out of this mess anytime soon. Maybe something can be done at the state level that would replace the ACA, but again, that's years away if it ever happens at all.
Yeah. Beth Dryer, I appreciate your time today.
Yeah, it's nice talking to you, Alex.